It's preparing to live stream the webinar. Setting it up. Awesome, we're good. Woohoo! Who's in the house? Reina's in the house. Occupational therapists unite. It's all about telehealth tonight. Woohoo! You want to do the intro, Mike?
Well, all right. Well, again, thank you very much for coming over in our Alternative Healthcare Career podcast and show. This is Dr. Mike Chu, a physical therapist and certified dementia practitioner, coming to you live here in the beautiful Martin, Tennessee. I got my co-host here, Dr. Emma Shapiro, physical therapist, very beautiful lady. And we've got a special guest for today. Our special guest for today is Miss Reina Olivera. I hope I'm pronouncing her last name right. But she's an awesome occupational therapist. Let me stop my share here. She's an awesome occupational therapist, and she's a telehealth practitioner. She's got this awesome group called Tele-Health for Occupational Therapists, and she's just doing amazing things there, an amazing job. And we just wanted to ask her some questions. How can we be like her? How can we be awesome like her? And just to know more about telehealth and how can occupational therapists provide the best service for not only for the clients but also for the occupational therapy profession. So again, thank you very much, Reina, for coming over. We really appreciate you. It's been a while since we talked, and we've been planning this for so long. So thank you very much, Reina. And Emma, I'll let you take over.
Oh, awesome. Well, I think, Reina, maybe we'll start from the beginning. And why don't you just tell a little bit more about yourself? I know that you're a telehealth occupational therapist that treats children with special needs, but maybe dive into how you discovered that niche and how you got started.
Yes, so I'm the owner of Telehealth OT Services, which started out as a private practice only in telehealth, serving children with autism who are homeschooled. I do see other children, but that is primarily my specialty. And that started because I was working in a clinic where I was treating kiddos, and parents would tell me that their children would do really well with me, but not do well with them at home. And so I said, how can I be like a fly on the wall and see what's going on in their home environment and really get a good picture instead of just telling them, hey, try this, when I don't really know what's going on in the home. So at the time I was studying for my doctorate, and I learned about telehealth. And so I was like, this is it. This is the answer. I don't have to leave to go actually in someone's house. I can just tap into it from their computer. And then life took me out of that clinic, and I still had to finish my doctoral program. And my faculty advisor was like, hey, I think you should just do eval to discharge on your own without the clinic as like your middleman. And so I did that for the capstone project, and then that got my mind thinking of like, well, I can just do this as a business. And so I started my business shortly after that.
Awesome. And how are things going? How do you feel like, because I think a lot of people want to do telehealth, and I'm so happy to have you on and represent occupational therapists, because I feel like a lot of people think this is just a PT thing, and it's not. No. And so, but how do you feel like how are the treatment sessions going? How do you feel like your results are?
Oh my gosh, amazing. People always ask me about like effectiveness. So is it effective? OT is so hands-on. How do you treat like a kiddo without touching them? And I personally use a parent coaching model, and I have seen so like amazing results with parents actually interacting with their child, learning how to interact with their child, and feeling comfortable and confident in what they need to do with them. And in turn, the child is progressing way quicker than they were in the clinic.
That's awesome. It's funny. So I briefly was a special education teacher. I grew up in special education. My parents are school psychologists, and my mom's a special education teacher. And I feel like when I saw that you were treating children with special needs, especially autistic children, it really was making me happy, because anytime I worked with those kids, they really gravitated towards the technology. And so I think finally we're able to communicate with autistic children because they gravitate more towards this environment actually anyways. Is that correct?
Yeah, 100%. A lot of the OTs that so now my business has taken a little bit of a turn where I'm training occupational therapists on how to do telehealth. And so many of them ask, well, how do you engage a child like on the screen? And I'm like, it's the opposite. Like they want to engage on the screen. Like kiddos that weren't paying attention in the clinic are now like, who is that? And they're excited to see me on the screen. And they take me around and it's like this running joke, like, put me down, like, don't take me into the bathroom. Like, like all these. So it's fun and they love it and I love it.
That's
It's just like
amazing.
engaging me. Ah, who am I? Well, anyway, Emma, I'm actually streaming. I'm watching in the YouTube channel, and it's just showing one picture. Are we able to do a side by side,
Yeah,
like a
let me
gallery?
how's that? Let's see if that's helping.
Hope
Give it a second
it's
to load.
probably a little bit delayed.
Okay.
I can see myself talking there, so I see
Okay,
my
well,
big forehead there.
well, while that's loading, Reina, why don't you maybe take us back a little bit so we can dive into telehealth as an occupational therapist and sort of share with us how you started to get set up. Sometime like the in between leaving the clinic and how you started. Sort of how did that evolve?
So I guess like people always ask me like where do I start? What do I do first? And I think one of the biggest things was learning like what platform to use, like the logistics of the technology side of it. Technology is going to fail. It's not, when and like it's not if it's going to fail, it's when it's going to fail. So learning the technology piece, learning how to explain that to the parent, choosing what kind of device, choosing whether you want a headset or not, like all these logistics for the technology was like where I had to start. Um, and then it goes into, assessments and what kind of assessments can I do via telehealth and, what kind of treatment style am I going to use? The treatment style I had chosen through the doctoral program and a little bit of the assessment tools, but I had to dive deeper into what assessment tools were appropriate. Um, so yeah, that's pretty much the very beginning was the technology piece and then how to do my regular OT via telehealth.
Gotcha. Yeah, just sort of how do you transition into that? And
Mhm.
for anyone listening, I'd love to know what type of niche you want to do your occupational teletherapy business in. Raina chose special needs, but what are you interested in? There are so many. I mean, the topics are endless, right, Raina? You can
Yes.
make a whole list and go on and on. So share those below in the comments. We'd love to know, and Raina can maybe give you some top tips too. Um, in terms of in terms of like rules and regulations, I
Mhm.
know the PT side, but I don't very much know the OT side. How do the rules and regulations for teletherapy affect you?
Yes. So, over before coronavirus, overarching law was like you had to be licensed where your client is a resident of. And so now, so I only practice in Florida, and even through coronavirus, I didn't expand and go, national. I just stayed in Florida. But, um, now the rules are a little bit more relaxed. States have waivers. Even before coronavirus, Florida had launched a law that outside states could get like a special permission, go through an application process and see our clients here. So each state has so many different laws and a lot of people want like a straight answer and it's like go back to your state and see really what they want. Some states will only allow you to see telehealth clients if you've done an evaluation in person. Um, mo- Most, not all, say that telehealth has to be documented in the chart. That's another thing that we kind of go back and forth on the laws, whether you, for billing purposes, whether you document it or not. That's written in the laws of some states that you do have to document it. What else? There's another kind of issue that has been coming up lately is like when clients go on vacation, can you still see them? And I don't think it's really clear in OT like what that is. A lot of the overarching telehealth laws don't include OT, unfortunately. And so we have to do like what we feel is best. And to me, it's like
Yeah,
if you don't see OT in there, like don't assume that that's for us. So my
that
take
makes
on, yeah, go ahead.
Oh no, I was going to say that that's pretty similar to PTs. We're the same way where check each individual state practice act. If you are unclear of something, let someone know. I mean, I've listened and tried to learn as much as I can about teletherapy and telehealth. And I feel like it's sort of like with taxes. Like I don't really know how to do my taxes, but I really do try my best. And I feel like that's sort of the same way with telehealth. Like if you were to somehow get a slap on the hand, you would just be like, I really did think I did everything right. And I'm sure like the AOTA and the APTA would be like, just don't do it again. And then you'd be okay.
Yeah, I think like by nature, us healthcare professionals are not trying to like break any rules. Everyone's trying to like, not lose their licenses that they work so hard for. But I've heard people that have talked to lawyers and they still don't get a clear answer. And so it's very like, it's gray all around, but we try to do the best we can.
Yeah, just like student loans, lots of gray areas there, but we can talk about that later. Well, that's awesome. That's really great to get the insight into the rules and regulations, because I feel like that's one of the first steps that we have to check off as therapists, just to make sure that we're, all good and following the standards. Now, a question I get all the time, and please, if anyone's listening, you have more questions for Reina, put them down below. But a question I get all the time is like, how does anyone choose you? How do people find you for appointments and therapy services, Reina?
So for me specifically, I have a website, and the telehealth platform that I use has like this booking widget that's on my website. They just click to schedule themselves. But I can talk, I don't know if we're going to talk about this later or not, but as far as like marketing goes, a lot of people want to know like, where do I find my clients? So not where do they find me, but where do I find them? And so I tried the traditional, like going to physicians and doing that whole thing, but that didn't work. And then I realized, wait, okay, I'm doing telehealth online, so I probably need to be more present in the online space. And so that being said, some of my appointments come through my Facebook business page, where
Oh,
they can
really?
do the book now, and then we talk about it, and then I bring them into the telehealth platform, or
Interesting.
my phone number is all around, and then they call me too.
Interesting. So you've had a lot of success on the Facebook business page, people just finding that. And are you sharing that in different groups, or how are people finding your page? I mean, your business is wonderfly named. And so
Thank you.
I think that's probably helpful. But
Yeah,
any other
thanks.
tips?
So groups, definitely being in groups where my ideal client is, and setting myself as like the expert there, answering questions and just providing value. And then I have my own parents group that I try to filter people into. And then from there, they get to know me better, and then potentially, become clients. So a lot of
So
Facebook.
yeah, and it's like a slow burn, would you say? Like I feel like, in our alternative healthcare careers group, a lot of people are like, I'm posting and nothing's happening. And I'm like, well, when did you start? And they're like, last week. And I'm like, it's taken me 3 years to get to where I am. Like it's a slow process. And it really is something that you have to build a relationship.
Yeah, I tell people that all the time. I'm actually running a business program right now, and I tell them, I said, like, start marketing now, like, start talking about your business right now, because it takes longer than you think it does in the online space, because there's scammers and hackers, and people are like, they don't want to trust anybody online. And so if you're trying to build those relationships online, it's going to take a lot longer for people to trust you and to eventually become a client. And so, yeah.
Now, are you making a lot of videos? Because I feel like, not all therapists are gregarious. Like I'm okay on these interviews, but secretly I'm like I sweat so much and I'm so nervous. And especially when I go and do videos by myself, it's really hard. So how communication wise, what are you finding is the best for your audience?
Yeah, videos, 100%. In my
Shucks,
parents, in
shiny.
my yeah, in my parents group, I was going live almost every day for 2 straight weeks. In my telehealth OT group, I was going live about 6 days a week for 7 straight weeks. And I mean, videos, 100% is like way more effective.
It's just that I feel like, and I share that with people, and sometimes I be hypocritical because I'm like, I really want to do Facebook Live, but my hair's bad and this, and I just stall. But I agree. It's like the only way for people to really get to know you. A blog post is okay, but it's all about video because then they can truly see your passion, your genuineness, and just your kindness, and just really your personality can be presented.
Yeah, I agree 100%. My second like best thing I would say is bringing them from, Messenger into a phone call. And again, like anything, communication via text message or messenger like gets misinterpreted, and even in the comments too. Like,
Yeah.
and so bringing those people, potential clients, into a phone call is even more effective too.
Awesome. Awesome. Let's see. So let's sort of do the flow. So we talked about sort of setting up the business and the rules and regulations, and now we're starting to get some people. How do you go about that communication, that conversation, going from complete stranger to let me now work with your child?
Yeah. Yeah, so my phone call, okay, so they have the option of scheduling a 15-minute discovery call with me, and which usually turns into like a 30-minute half eval. Like, it's, I can never get off the phone soon enough, but so if we do that, they get a good feel of what it's like. If we don't do that and just on the phone, I explain to them, I say, I explain to them the logistics of it. You're going to get a link, you're going to get an invitation. It's going to prompt you to download an app. The app is free. And then we're going to get on a call, and I'm going to ask you a lot of the clients that I've seen, is not their first time going through therapy or OT. And so I tell them, I'm going to ask you all the questions you've already been asked in the clinic. And we're just going to go through all the questions. And then we'll have our first formal, like, we'll set the schedule and we'll have a first formal appointment after that.
Gotcha.
Yeah.
Awesome. Well, you probably know the next question. It's pricing. And once again, people in the comments, like, I'm not an occupational therapist. I'm a PT. And so I'm trying my best to make sure that you all are learning from this wonderful occupational therapist sitting right next to me. But if you have any more questions, put them down below in the comments. Thank you. So let's talk a little bit about pricing, Reina.
Yeah, so pricing is pretty tricky. My suggestion to people for pricing telehealth sessions is to look at what the pricing is in your area for in person and make that comparable, and not to assume that you should charge more because it's convenient or charge less because it's convenient. Like, the client doesn't have to leave the house and you don't have to leave the house, so it's less. Well, no, like, we're providing the same critical reasoning skills, and we're providing the same level of service. And so the rates should be the same as an in-person clinic that treats the same kind of clients. And so that is, after I've done my research, that is how I set my pricing. I do occasionally try to do like a package deal, get like 12 sessions for, a set amount of price. It goes okay. Sometimes they just prefer session to session, which is fine with me.
Yeah. And at first, I think it's like people want to dip their toes in and test the waters, especially if they maybe have done in person and don't trust tele. They may think, well, I don't know if my child's even going to take to you. So
Exactly.
test it out.
Mm-hmm.
Now, are you using insurance, cash? Maybe go through sort of like your thought process for that, and how do you feel about, cash versus insurance?
Yes. So I say that I'm a cash-based provider. If anyone asks me, I'm cash-based. But that being said, most of my clients come through a special scholarship that's available in Florida for children primarily with autism, although there are other diagnoses that fit into the scholarship. They cannot go to public school. They either have to attend private school or be homeschooled. And so therefore, they're not getting OT services through their schooling. And so the scholarship provides funds for the parents to pay for special services, including PT, OT, speech, ABA, private school tutoring, testing, a bunch of other things. And so I became a direct pay provider through that scholarship program. I submit the reimbursement request to them directly. The parent doesn't pay me. The scholarship pays me under their student ID. And then the other part of it is cash-based. I don't deal with insurance at all.
Well, that's interesting. I never thought that there would be scholarships for services. I mean, now I'm thinking about it and it makes sense. But that's amazing thing. So that's, people, scholarships, look into it. Like,
Yeah.
if you can provide paid service, but it's free for your clients, like, that's amazing. And that's amazing. I mean, one, it's amazing that Florida's doing that. I am a little confused why they're not letting these children into their public schools, but
no, like the parents choosing for the child not to be in public school.
oh, okay. And so
Yeah.
they choose that, and then they get the scholarship because they choose a
Mm-hmm.
different school.
Yep.
Interesting.
Mm-hmm.
Okay. Well,
Yeah.
I mean, I think that's, I'm diverging here from our topic, but I think that's actually sort of, a really nice idea, because what if that child is just not doing well in that environment? We
Right.
don't want to put the child up for failure. So let's give them a couple different choices of how they can succeed.
Yeah.
So I like it.
Yeah.
I like it.
It's great. And I haven't really heard of anything exactly quite like this in other states. I've looked into it. There are a couple states that have something similar, but I don't think it's exactly like this. And so it needs to be more available to families. They love it. They
Yeah.
get up to $10,000 a year to spend on these services, and they can even get like equipment covered, computers, iPads, special DME. I mean, you name it. Like there's so many, there's a bunch of categories.
Is there an age cutoff for that? I'm just,
It's like a K-12, so it's only for the school time.
Gotcha.
Yeah.
But that's amazing. Go Florida. Wow.
Yeah.
I went from being confused to like really proud and happy about Florida, because I mean, from my special education background, it's just not everyone. And I mean, we see that in all environments, children with ADHD, they're failing classes, and it's not because they're a bad student or that they, aren't smart. It's just the environment. So if we put them in a different environment, they can get the grades and they can succeed. So I love it.
Yeah.
Welcome back, Mike.
Unfortunately, ADHD is not one of the diagnoses, and it's so sad because those kids do fall through the cracks in school, and it's not one of the ones, but yeah.
Let's see. Well, what's the next topic we should talk about, Reina? We went through pricing. We're getting our clients. Do you want to go through like how do you even do an eval? Because I'm sort of nervous when I meet someone for the very first time, and I especially can't put my hands on them. I don't even know sort of where to start, and maybe for a new grad occupational therapist, they want to feel empowered to do this. So any tips or advice?
Yeah, so the first thing that I tell them is to approach it from a especially now, like helping out the family. Like, what are you struggling with? So my number one question is, what are you struggling with? Not what are your occupational therapy goals, or like what developmental skills are you trying to reach? Like, what is your family unit struggling with? And I think if they approach it from that lens, they're better able to create intervention strategies that are going to fit the family. And so not standardized evaluations. We'll just talk about this, like parent interview, observation of the child, observation of the parent and child relationship. And again, I'm talking pediatrics, but this is the same for adults, like observation of the caregiver with the client, observation of the home environment, and really taking inventory of what's in the home and what you can work with. So non-standardized like assessment or evaluation, number one. Number two, if you need a standardized assessment tools, there are evaluations that have been made digital for telehealth, but not necessarily standardized for telehealth. So I think that's like a whole nother conversation about which assessment tools you're using. But, I like to say, choose an assessment tool that is like a questionnaire, parent questionnaire, caregiver questionnaire, or choose something that you can observe and not something that requires like gadgets and gizmos. Like the Peabody requires a stacking cubes and whatever. Like you cannot use that obviously through telehealth. So picking an assessment tool that you can do virtually by observing or by having a caregiver assist you with positioning, etc. So yeah, that's my whole. I don't really do a lot of standardized assessment tools because I'm not relying on insurance. I don't have to provide numbers to anybody. And so I use goal attainment scaling, and that is, my outcome measure. But I just do checklists and, ask the parents like some questions and have the child do some activities based on their age. And that's like how I formulate my evaluation and how I formulate my goals.
Okay, gotcha. So a little bit simpler evaluations would be like the big gist is that you can do those complex evaluations maybe later as you get to know the child more and as the parent becomes more skilled in combining holding the camera
Yep.
and doing the activities with the children. Awesome.
Yep.
Now, in terms of progression and exercises, are you just like on the camera, like do this, or how are you leading them through the exercises?
I
That's
love
my
that.
dance moves, by the way.
I love that. So what I really like preach in my group and my message to the OT community is to go back to basics and go back to functional skills. And so I don't want to say like blanketly I'm not doing exercises. I will stand up right here and like show them some moves, but like I want to really sit here and have them take me around their house and do functional activities. So if a child is not making their bed, going into their bedroom and saying, let me see how you make the bed, and actually helping them make the bed, cooking, going to the restroom, like functional tasks, ADLs, IDLs that really are going to help the family dynamic and help the routine and help the structure in that house. And so I'm not, as worried about all the other things. I will incorporate some exercises and some games and physical activities, but I try to really focus on function.
Yeah, that makes sense. I mean, I've had I work with the opposite population, seniors, and I've had a couple people go home, and they've been asking about virtual care and asking about home therapy. And I'm actually very happy that these veterans get to go home, because I'm somewhat limited in what I can do, because the best test for certain things is just to actually be in the home.
Mm-hmm.
And so I think, for those of you listening, that's an argument that you can use with your clients if they're at all afraid to do virtual care or telehealth, is the fact that for once, this could be super applicable to that exact difficulty that your child or that whoever is having. You can go and see the exact room and, the exact layout. And so I just think that that's a great, uh, thing to keep in the back of your mind for when you have those client conversations.
Yeah, that's one of the huge benefits of telehealth, is actually seeing, like you get so much from seeing. And I think a lot of OTs want to have a physical like craft or activity like made and ready to go, and have the client, the parent or child like replicate that. But so much of the time I say, will you just sit back and observe like their parent relationship and see where, like what they're dealing with, and then suggest an intervention. And so that is like what my huge message to everyone is, like, stop planning, try to be more flexible, try to go with the flow and see really what the family needs.
Awesome. Now, I'm sure we're going to have some new grads on, Reina. So do you have any advice for new grad occupational therapists looking to start telehealth? I think first, maybe I'll reel it back and say, should a new grad start telehealth?
Oh man, I haven't been asked that question before.
Yes, new
I
question.
I remember when I was in OT school and I wanted to be a travel therapist, and I wanted to start my own private practice. And so many of my professors and other OTs would be like, no, you cannot do that. Like right out of school, you're insane. And I'm sure people are saying the same things about telehealth. And so I'm not going to be that person. I'm not going to be that person to say you can't do it like your first year. Um, I'm going to be the person that says that if you want to do it, you can do it. Just make sure that you educate yourself appropriately first. If you haven't had a field work in telehealth, make sure you observe, a few OTs before, take lots of classes, and just do, your due diligence before just kind of winging it and seeing how it goes. So
Yeah,
that's my
excellent
advice.
I mean, I give that same advice too. I mean, I think you can never say never, because it depends on the skills too. Like I was a new grad, and when I graduated, I felt mediumly confident. I wasn't like, oh yeah, I can do this and this, but I wasn't like very timid. I was sort of in the middle. But I know some of my classmates were maybe a little bit more behind in terms of, I wouldn't even say their skills. It was more about their confidence providing the skills, because
Right.
I feel like that's the important thing, is especially when you only have video, and you can't take that moment to look at someone and take that time. You really have to portray your confidence so much more.
Mhm.
And so I think where I oftentimes advise people is I'm like, if you feel confident,
Right.
and obviously there's like an extent of like being too confident and cocky,
Mhm.
you know, we want to keep learning. But I think that that's sort of the area that I lean towards too, is how do you feel treating independently? And
Right.
if you're comfortable treating independently, then you know, you can do anything. But I agree. Get some more like mentorship, or
Yeah.
maybe just like ask a fellow OT that's a bit senior to you to just like hop into your sessions almost, and
Yeah.
they can sort of observe you too.
Yeah, I also recommend people that are looking into telehealth companies to make sure that one of the questions that you ask is, do they have mentorship? Do they have training? Some do and some don't. And so that's a key question, especially if you're a new grad, to make sure that you have the appropriate mentorship within the company that you're going to work for.
Definitely. That's for new grads. That's for anything.
Anybody. Yeah.
Get a little mentorship. We all need some help.
Hmm.
Now, any advice for new grads who are like, yeah, Reina, like I'm ready to do this. And if you are a new grad ready to do it, put it down below. Put it down below. We are so pumped to see you, and I want to support all these amazing OTs and new grads. But any advice?
If they want to do it like on their own or working in a clinic or getting a job, which one? Or all of them?
All of them.
I don't, oh God, I would say, okay, here's a good tip. Uh, my tip for that confidence level, and touching on what you mentioned about being confident, and I say this to the families I work with, and then I tell the OTs to for themselves and to tell the families that they work with, is to, especially now, like we're in this day and age where everyone's using technology, everyone has like one of these, right?
Yeah.
So pretend like you're on FaceTime with your loved one, like with your family, your brother, sister, your best friend. And as an OT, if you pretend like that, you know, you're going to be able to build rapport with your client easier. If you tell your client to pretend like they're on FaceTime with their friend, they're going to be like, oh yeah, I get this. Like I have totally showed, you know, Auntie Kelly, like how Johnny's doing. And I just take the camera around and I show her. And so I think that just kind of like breaks the ice on that whole like tense, oh my God, I'm on video with someone I've never met.
Yeah, or I'm sure they're probably embarrassed. Like, don't mind all the
Don't mind the
things
mess.
all
Yeah,
around.
yeah. I say that to my families all the time. Like they're like, "Oh, sorry about the mess." I'm like, "I really don't care. Don't even worry about that."
See, I almost think you should break the ice by having a mess behind you, Reina, and so then you're like, see.
Yeah, yeah, I love that.
So I know we have a lot of assistants watching too. Can you speak to a little bit about what they can do and what they cannot do in terms of telehealth OT as well?
So it varies again by state, and you know, the laws are different, whether you need the OT to be there supervising on those calls. I don't know too much more than that, to be honest. Like I just know that there are laws and they need to look into it and not assume that it's the same as it is in person.
Okay,
Yeah.
gotcha. But I would maybe think that the supervision requirements still are the same. Do you think? I know you've
I
done it.
yeah, I think that some states require like the OT to be supervising like all the time or maybe more frequently. Or oh, you know what I had read? That the OT needed to be, so especially switching from like if you're doing a hybrid model or coronavirus style, like switching from in-person to telehealth, that the OT is the one who needed to determine if that client was appropriate for telehealth, even if the OTA was seeing the client for years, it doesn't matter. Like the OT needed to kind of do a reassessment, determine that they were good for telehealth, and then the OTA could pick up.
Okay, gotcha,
So that's
gotcha.
one thing that I remember reading about, but yeah.
Okay, perfect. So, codas, I'm sure that you can do treatments, but yeah, I think look a little bit more into those rules and regulations. And if you have any information on that too, you can let us know as well,
Yes.
because we'd love to help support our wonderful codas as well. Let's see. Okay. Questions.
We can talk about
Hey.
interventions.
Yeah, let's talk about some interventions. That sounds good. And then I definitely want to talk about technology at the end and get your like 3 top tools that you use to run your business.
Okay. So, yeah, so, I did talk about interventions already, but I'll talk about it a little bit more. So I used, so I wanted to touch on this because I think it's so fitting for, it's fitting for me, but I think personally, but I think it's such a good fit for telehealth. And it's a parent coaching, or it's really called occupation based coaching model. And so I talked about this briefly before, but it's really working with the parent or caregiver on, what their needs are for the client and helping them with their relationship. So you are really observing the parent-child relationship. You're working with the parent on what the goals are. You're working with the parent to problem solve and critically think about what could be going on with their child. You're creating interventions together, and then you're observing the intervention process, and then you're providing feedback. And so I think that it's, especially coming out of school-based or coming out of clinic-based, is so different, unless the clinic does, involve the parents, but many don't. And so the parent coaching model is just perfect for telehealth. And that's what I use, and that's what I recommend that people learn and study and figure out how to do it right to really make that telehealth session successful.
Definitely. Yeah. I think communication is so important, and involving that, especially as, I think most of the issues that in pediatrics, and I am not a specialist, but just coming from my special education background, it often, the parents felt the difficulty, maybe sometimes more than the child. And so oftentimes you're almost sort of helping the parent, would you say?
Yeah, 100%. I am more of a like parenting skills 101 like coach than I am like treating the child directly. But as a result of that, then there's better carryover. The child progresses better. So, it's good. It's really good.
Awesome. Awesome. Well, Elvin, you're on here. I'm going to check to see who's on here. But if you have any questions, I'm starting to run out of some questions here for Reina, but I want to capitalize on her time. So please,
Yeah,
Elvin,
ask a
anyone,
question.
put it in the chat, put it in the comments. So I think maybe let's dive into technology here, because
Yes, we can talk about
there's
that.
so many tools. So what are some of the top tools that you use?
Okay, so let's talk about client, like OT side. So I'll talk about OT side, I'll talk about client side. So from my side, I use like a large monitor, but some OTs prefer to use 2 monitors. If you're trying to do telehealth from like a small laptop, you're gonna find yourself struggling because you want to pull up your note from last week. You want to maybe be typing your note at the same time if you have back-to-back sessions, and you also want to be able to see the client, or maybe you're sharing your screen. And so either having a large monitor where you can split up some of the windows, or having 2 monitors. That's the
Okay.
first thing. The second thing is consideration of a headset. So a lot of people see me using like this Logitech headset that I got from Best Buy, and they're like, I have to get one. Reina's like the telehealth OT and she has one, so I need one. You don't have to use a headset. This is like, part of it's personal preference, part of it is patient privacy. So I don't want like my family who's here to hear what the client is saying. So it's in my ears. I also don't want the distractions of what's going on with my family here to distract me from the session. So, them being in my ears helps me. Um, Also, maybe some of the sound quality may be better, like, with the mic directly like near my mouth. So that's why I use it. Some people don't want to use it because, and I don't get up as much as I do. But even if I were to get up, like this is pretty long that I can come back here and I can stand up and I can do, get on the sofa or stand up on the floor and do some exercises. So it's a long enough cord. People ask about Bluetooth all the time. And, it's like, oh, well, I don't have to be tethered to the cord. I can just use Bluetooth. But I've seen and heard of Bluetooth disconnecting, and then you lose your sound with your call. And so I don't recommend Bluetooth all
I
the
actually
time.
have a really cool, let me grab it for a second. I don't want to
Yeah.
interrupt your flow, but
No, it's
I
okay.
got this really cool headset. Let me show you.
Yeah.
Okay, so I wanted to get something because I'm starting to do videos for the VA, and I'm starting to, work more virtually with the VA. And so right here, this is a Bitron wireless lavalier, and this is like amazing. This is only like $30. That's like $29.99, and it's similar to like the Logitech that you use. But what you do, you take this, it's like a receiver, and you can put it in your phone, or you can put the receiver in the headphone jack. And then this is just your lavalier, and this goes onto your belt loop.
Oh,
And
awesome.
and
And then
it's
you're
so,
free.
yeah, and then you're free.
That's so cool.
And the sound quality is really good, and you can even adjust the how loud it is. And I've just been loving it for my videos. And I can go do exercises then and not be limited whatsoever.
That's awesome.
Just really fast rule of thumb with this is what a couple of my videos I was doing. I think I was doing like dead bugs, and I was like turning my head for the camera, and it pick it up as well. Like, so you want
When
to have
you're
this be like close to your mouth, or maybe in the center of your collar. So that's the one nice thing about yours, Rain. It's like
it's like right
right by
there.
your mouth the whole time. So that's the only rule of thumb for this is,
Mhm.
if you're turning away and talking, then it's not going to be as good. So just try to like, you know, have it in a good position. But I love it. And I'll put the links
I
down to
love that.
this, and I'll put the links down to Reina's a Logitech too.
I love that. Um, yeah, okay, so let's see. So that is, I think that, lighting. So I didn't have good lighting for long. I actually just got this like, I don't know, 3 weeks ago, 4 weeks ago maybe. So I have a ring light now, but if you don't have a ring light, setting yourself up so that you have good lighting so your clients can see you, super important. So I do recommend that. Some of the other recommendations, again, something I don't use, but that a lot of OTs rely on is a document camera so that you can see the surface of like where you're writing, and if you're working on writing or a fine motor activity, like your client can see down at your desk.
Okay.
um Again, I don't use it because I'm trying to just like verbally communicate what I want them to do. If I want them to write, I'm just guiding them through that. I'm not showing them necessarily writing. I could pull up a dry erase board on the computer and do that, but a document camera. And one of my great colleagues who has been doing telehealth for a while now, she recommends the IPEVO. It has like swivels, a bunch of swivels, and you can kind of position it wherever you want. And so it looks really cool. And so that is another,
And that's a camera or
it's a document camera. Mhm.
document camera. Cool. Okay. I'm
Yeah.
going to have to search these and put these all below.
Yeah.
I haven't heard of these before, but it sounds really helpful, especially for like fine motor. This is for like
hmm
fine motor
Yep,
tasks.
for fine motor. Yeah.
Gotcha.
All right. And so for the client side, I often get people who are trying to join on their phones, and if that's the only choice, fine. My preference is for them to join on a tablet. So why not the phone? The phone, like they get a phone call, it gets interrupted. They're on their, if they're not on their Wi-Fi, they're on their data for their phone carrier, and they're using their data. So I don't love like a phone unless it's the only choice. But so I like them to be on a tablet so that they can be mobile and take me around the house and just like prop me down
Mm,
somewhere and prop me down over there, and I can see, everything. A laptop is okay too, but it's just more bulky. And
yeah.
so for the client side, that's my choice for them. I don't have them wear headphones or anything unless I don't, I know some OTs do have some kids wear headphones if they're like an older child who needs to work on something directly on the computer, and having them have a headset helps them focus and stuff like that. But I don't require that for any of my sessions.
Okay. Awesome. Awesome. And then what about just sort of running the daily business? Any tools? We don't want to give away all your secrets, but any sort of tools that you'd recommend to just make your life way easier?
Let's see. So I use Simple Practice for my telehealth platform.
Okay.
Um, I'm an affiliate for them. I absolutely love them. That is my go-to company. It didn't start off as an OT telehealth company, but it's an EMR telehealth combination. It started at mental health, and they live to their name. It's super simple, easy to use. I for the other part of my business, I use QuickBooks for my accounting, and I use Trello for my organization. What else? Oh, this is a good one. So as a private practice owner, I had to have, and I don't know if this is like just in Florida or not, but I had to have an address to register my business, which we all do, but I didn't want to use my home address, and so I needed to use another address. So you think, oh, you can use a PO box. I couldn't use a PO box. So another company that I use is called DaVinci, and they provide a virtual. It's called a virtual address. I can physically go pick up mail there. It stands in a Remax office, I think. But so it's my virtual address, but I can't use it as my office, if that makes sense. So
Interesting. All these
yeah,
taxes and rules. Come on, make it easy
yeah,
for people. Gosh.
yes.
Well, Alvin has been here like the whole time. Alvin, you are amazing. So Alvin was asking, how do we bill? Do we bill it under an independent NPI or a company NPI? Do you want to go a little bit into, and billing is, I know, really complex. We could be here for days, but any sort of tips on billing?
Yeah, I can't answer to that because I don't bill at all. So
Oh
I
yeah, because
don't.
you do cash mostly. Gotcha.
Mhm.
Gotcha.
Yeah.
So you don't even need a provider number for that.
Yeah, I don't need a provider number. I do have my EIN, and I needed my EIN, and I needed my account for the scholarship. That
Gotcha.
Yeah.
Gotcha. That's a good question, Alvin.
I'm gonna answer
Maybe
that
Mike
real
knows.
quick.
Woohoo, Mike's back.
There we go.
I'm gonna answer that
Superman to
real
the
quick.
rescue.
Yes, if you are going to bill Medicare through the telehealth, you will need to either have obviously your company NPI or independent NPI, or your P10 number through Medicare, because obviously you're billing them. So you will need that.
Does it
And of
matter
course, right
which
now they're
one,
letting us
Mike?
do it, huh?
Does it matter if it's an independent or a company?
No,
Like, which do you think
I
is
mean, if
better?
you own the company, that's independent, just like me. I'm independent, so I can bill it directly as myself. But of course, you always want to think at the end in mind. What does that mean? When you're doing that, you want Medicare or the insurance company to recognize you as a company. So as you get bigger, I'm not big, right? As you get bigger, I want to be big, girl. As you get bigger, and then you're billing your company NPI. So the Medicare is looking at you. Oh, he's billing different, people under that company. So that's more beneficial for you in the long run. So always think at the end in mind. In that way, as you scale and get bigger, because like Reina, right now she's doing it on her own,
Mhm.
but eventually she will need other people that will work under for her. So
Mhm.
obviously she already set up her LLC and everything. So that's going to be beneficial for her. So same thing with whatever Alvin is asking. Yes, you can bill it under your individual NPI, but like what we always say, bill it under your company. So in that way, when you get established, you're underneath it. You got there. You see my underwear? I was just kidding. So I hope you get what I'm talking about. So I hope that helps you,
Gotcha. Gotcha.
Alvin. So
And Alvin had another really good question. Is the video platform that you use HIPAA compliant?
Yeah, I just saw that question. That is a really, really great question. We can talk about this for a little bit. So yes, Simple Practice is HIPAA compliant, and so I signed a BAA, Business Associate Agreement, with them. Now let's talk about Zoom, because a lot of people think that they can use Zoom. So before coronavirus, you could not use Zoom as your platform, and only the Zoom for healthcare is HIPAA compliant. Now, during coronavirus, the HIPAA laws got relaxed, and now you can use Zoom temporarily, the free one, to see your clients. But I caution people against that still, because it doesn't mean that because, government allows you to use Zoom now, that it means that it's HIPAA compliant all of a sudden. It's still not HIPAA compliant. It's still not best practice for you and your clients. So if you want to use Zoom for healthcare that is HIPAA compliant, make sure that any platform that you use, you are signing a business associate agreement. Some of the other ones are doxy.me, the free version, you sign a BAA. Google Meets with G Suite under Google, you sign a BAA, so you can use Google Meets to be HIPAA compliant. There's a bunch more, but those are like the basic ones that I want to mention now.
Awesome. No, that's really helpful because there's so many platforms. Now, do you, maybe for those who don't know what a BAA is, go over like really quickly what that is, who provides that, do you provide it, etc.?
No,
Before Reina answers that, I want to just say what BAA means. That's what the sheep always say. Just kidding. Bah. Bah. All right,
Yes,
go ahead,
bah.
Reina. I'm gonna escape. I'm gonna leave you, ladies. I'm just messing around here.
It's okay.
Thank you, Reina. Thank you.
All right.
You can stay.
Are you
stay.
sure?
Yeah.
Yeah, you can stay. I don't mind.
Oh my
All right.
God.
This
We
is
need
your
to be more
thing.
entertaining. You're more. Who thinks Mike's more entertaining?
I know, right? We're like down to business, very serious, and he's like, bah.
I had one patient ask me, what am I signing here? I was asking him to sign. I said, you're just signing your life away. So it's just like, yeah, I don't have anything anyway, Michael. I'm like, okay, sign everything. So, oh, well, okay. I hope that wasn't recorded, right? I guess it's already recorded. It's live, right? So, oh gosh. Go ahead, Reina. Answer what BA means.
All right. So a BAA is a business associate agreement, and we do not provide that. The company that you're signing with provides it. So Simple Practice provides it. Google provides it. Doxy.me provides it. And it's a document basically saying that they are going to protect the patient information. So you're signing a relationship with them, saying like you're entrusting them to protect the information for you.
Gotcha. And does that cost any more money?
No, not usually. No.
Okay, perfect.
Yeah.
Alvin had another really good question. Keep them coming, Alvin. He's asking, do you have any employees? And like how to, like how would this work if you had employees? Like what are some things that maybe you would need to think about?
I don't have any employees. Some of the things that come, I do have a lot of people interested. My goal is to grow the practice. So that I have the two sides of my business, like the consulting side. So I was teaching OTs about telehealth, and my client side. One of my goals is to grow my client side nationally and employ all of these fabulous OTs that keep calling me and asking for jobs. I don't have any positions open. It's just me providing treatment, but if someone had, a big practice and wanted to employ OTs, some of the considerations for telehealth are that these platforms sometimes charge per user. And so you have to be mindful of which platform you choose based on how many employees you're going to have, how many people are going to be tapping into this. Simple Practice was a good choice for me by myself. I think once I start looking into adding people, it's like another, I believe, $49 a month per person. And so you have to think about what it means to have employees, like having them be a user on your Google, having them be a user on your platform, scheduling. Also, I think just like as a cash-based provider, like one of the things that that sets me apart, like as a business, you always want to have something that sets you apart from everybody else, right? So like what sets me apart is that I want the client to feel like they have an OT in their back pocket. And so if I were, so I let them text me or they can call me as a one-time follow-up to their video call. And so if I hire someone, or when I hire someone, I want them to, be using the same, like, that same vibe, like that same, they can call whenever. And so if an employee is not agreeable to that, then they're not going to be a good fit for my business model.
Gotcha. Yeah. We want to, you want to maintain company culture. Definitely.
Mm-hmm.
Now, Alvin actually had a really good question, which I did not think about. And he brought it up is, how are the doctors taking to this? Like, how do the pediatric physicians think of you, and how is that relationship going?
Yeah, so I only approached one physician. Oh, so this is another thing we can talk about. Some states don't require you to have a prescription from a physician, especially if you're cash based. And so Florida is a direct access state, and so I don't need to associate with physicians at all. But the one that I did go talk to in the beginning when I was trying to do marketing and build those relationships, took to it very well. I made sure that I went to another cash-based provider, so she already knew, like, that same business model. And funny enough, obviously after coronavirus and everybody's turning to telehealth, now they're even that much more receptive to it. That one physician like emailed me, hey, like I thought about you as we're all switching over to telehealth now. Like, let me know if you have any referrals and I'll let you know if I have any referrals. And so I think especially now people are way more receptive to telehealth, and it's just a matter of us educating, everybody, not just physicians, on the benefits and the effectiveness of telehealth, even though the research is limited.
Definitely, definitely. I think, when coronavirus hit, we were struggling at the VA, and we were like quickly trying to go do virtual, and a lot of people actually said no to virtual. They said, no, I'd prefer to wait for the clinic, and
Mhm.
and those patients are more outpatient, and so there's a different urgency that comes with outpatient visits than other visits. But I think yeah, it's just all about education, and just the more we have Alvin out there and Reina out there and other people out there that are proving that therapy is really helping through telehealth, I think the more, that's going to grow this side, and prove to people that, we can really help people
Mhm.
anywhere,
Yeah.
anyway, anyhow.
Yeah. I think that in the middle of chaos like that this crisis is like a blessing for telehealth, for telehealth and all of healthcare, to really let people know that this can like we can do virtual.
Definitely,
That is
definitely.
so true. I love what you said about that. In the middle of in the middle of crisis or in the middle of adversity comes out some opportunities. And without this crisis that we're going through right now, we wouldn't be able to actually leverage telehealth. So I really love that.
Mhm.
Another thing that I do, I'm gonna butt in here because I'm just like so tired doing. One thing that we do is actually interviews those actual pediatric doctors. You can
Mm,
do that. So what I do, I interview different physicians in the area, the nurse practitioners, the physician assistant, the orthopedic doctor clinics, and I would interview them about dementia, which is my specialty, and then they refer
mm,
those patients to me, talking about Alzheimer's and dementia. So same thing, whatever telehealth OT you want to specialize in,
mhm.
start interviewing people. Be comfortable with the camera. I'm
Yep.
sure Reina wasn't comfortable in the camera in the first place. Emma, I know you ladies are so beautiful in camera, but I'm sure in the very first time you went in the computer, you weren't. I'm like
Mhm.
that too. I'm just always conscious in my forehead, and conscious on my accent. And as
Mm,
you do this again and again and again, and you become animated with your clients over the phone, over the computer, it's going to be so natural. And bottom line, you're helping people, you're
Yeah.
changing lives, and you're improving their quality of life. And that's our ultimate goal, whether it's telehealth, live, online, even over the phone.
mhm.
You're
Well, I,
already
I really
changing their
think
lives. So,
actually, no, that's so great, Mike, that you bring that
mhm.
up, because, I think a lot of times as therapists, we may be frustrated with physicians, but physicians don't know us. And so,
Mhm.
I've like doing a podcast, doing a show was the best thing for me ever, because it brought me like into people's lives. And chat is one thing and email is one thing, but to actually meet someone over, in person, whether it be on the computer or not, it just increases that level of familiarity,
Mhm.
and you think of that person then because you can put a face to the name. And so I think you're right, like interviewing, but even maybe, Reina could just invite, and maybe she has, but invite the doctor to be like, hey, I really want to show you like how great, Bobby is doing. Do you have like 15 minutes just to hop on when we have one of our sessions? And he could pop in and see like how great Bobby is doing and be like, wow, this is really working. And that's going to just boom, have send Reina lots of clients.
Yeah, I love that idea. I'm actually starting the Telehealth OT podcast soon, so I'm gonna have to throw in some physician interviews in there. I hadn't thought about it, but I love that idea.
Yeah, yeah. That's what I do with my podcast, the Misunderstanding Dementia podcast.
Mhm.
And I would interview the administrators of the different assisted living, administrators in nursing home, social worker, discharge planners, obviously physicians,
That's
and then
awesome.
their assistant, and just creating that relationship. And yes, you may not be able to get a patient in first time, but as you keep continuing to promote yourself, being the influencer, being
Mhm.
the person, the go-to person in that specific field, oh gosh, you're gonna
Mhm.
get patients. I'm busy right now. I'm with my student here, and we're just busy already. So yeah.
That's awesome.
Amazing. Well, Reina, any last tips or advice before we, end this amazing webinar?
I don't know. Have fun with it. Like, just have fun with it. I think, let me see what the last line of my book. I think I said something. I had to think about this because I was like, how do I end my book? Um, I said something along the lines of like enjoying your telehealth.
Like having
Well,
fun
enjoying the
with it.
process. Yeah. The
Yeah.
best advice that I can give you is to enjoy the process of becoming a telehealth practitioner. I think it's a process. It doesn't happen overnight. And I think it's just important to, enjoy the process, not let it stress you out and just really just have fun. Just have fun with it.
Awesome. Awesome. And then one last thing, Reina, you have an amazing course, and ACG, we've partnered with Reina to give you $100 off of her course. Just because we want to inspire change, and we think Reina is just an amazing occupational therapist and leader
Thank you.
in the telehealth OT realm. So where can people go to learn more about you and ask any more questions if they have any?
Yes, so they can go to my website, telehealthotservices.com, and they can reach me via email at info@telehealthotservices.com or via Facebook.
Awesome. And to get the $100, I forget, did
Oh,
we
and the
just
code for the $100 off is ACG, all upper caps, 2020.
Awesome. Perfect. And I'll put all those links below. And Alvin, we promised to give a prize here. And Alvin, you very much deserve it. So you get the free side hustle school course. So come email me at alternativehealthcarecareers@gmail.com. And I'm going to hook you up with that, because we just really appreciate, everyone taking action, and we really want to inspire you to take action and change. So thank you so much, Alvin. Thank you so much, Reina. And thank you so much, ACG, for being on here. Woohoo! Share
Yay.
some love in the comments for Reina. And if you have any questions, you can message her or put them in the comments below too. And we'll be actively trying to help you as much as we can.
Can I
Yes.
also win that side hustle thing?
No, you can't, Mike.
You
No,
can't?
not at all.
Oh gosh. All right. Again, thank you very much, Emma. Thank you very much, Reina. But before we let you go, all right, before we let you go, let her find. Ugh, I'm running out of English. It's 7 o'clock. It's way past my English time. Reina, is English your first language?
It is not. It's my
It is
second
not. So
language.
you know what I mean, right?
Yes.
So if English is not your if English is your not if English is not your first language, comment down there what's your first language. But before I let you go, ladies and gentlemen, always remember the word fast. FAST. Why? Because speed wins. Speed wins. You know why? Because you want to take action fast. FAST. Letter F. Find friends that will push you to your next level, because you are the average of the 5 people you hang out with. So whoever you hang out with, you're gonna be like them. If you want to be a telehealth OT, hang out with
Come hang out with
Raina.
me.
Join her group. Oh gosh,
Yes.
her group is just growing and growing.
Oh, yes.
It started with one person. Now it's like how many?
Over 6,500 in like
6,500.
9 weeks.
Imagine that. 6,500 people of same like-minded individuals that will actually going to push you to be an occupational telehealth occupational therapist. Guess what? You hang out with those other, I'm not saying other group. I'm go to the other group. You're going to see it. They're going to just pull you down with all the negativity.
Mm.
Go to the group that will push you to your next level. Letter F, find friends that will push you to your next level. Letter A, you gotta learn how to take action. Letter A, is that how letter A is?
Yes.
Is that how letter A? Telehealth OT. Letter A, you gotta learn how to take action. It doesn't have to be big. It doesn't have to be small. All you need to do is just take action. One small action is going to help you move on to your next step. You know, imperfect action beats perfect in action. My student here right now, I asked him to publish a book. Guess what? He's a published author now. You know, it's just amazing. You know, he's actually typing his next book now. So take action, guys. Take action. Letter S. What's the next letter? Letter S. Not Superman, because Reina and Emma are superwomen. Letter S. Share and subscribe. Share and subscribe. Share Reina's group. Share Emma's group, and subscribe to their podcast, because that's how you grow. That's how you grow.
Yeah, subscribe
share.
to this channel. This is
yeah.
our channel. Subscribe.
Yeah, this is our channel.
please.
Okay, subscribe in our channel. All right, subscribe in our channel. What's our channel?
Alternative healthcare
Alternative career. Okay, alternative career show channel. All right.
I'm so sorry, people.
Share, because sharing is caring. All right. Last but not the least. Last but not the least, letter T. Letter T is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. And that's why Reina is teaching it. The more she teach it, the more she understands it. Same thing with Emma. She's teaching me all this technology. And she's learning. I'm not. She's teaching it. I'm not learning all this technology. So I always ask Emma. So teach it, ladies and gentlemen. Emma, Reina, thank you very much.
Thank you.
Thank
Thank you
you.
so much, everyone.
I'm going to go ahead and share this slide. I'm going to play our music. Again, thank you very much.
Woohoo. Bye, everyone.
Bye.
Emma, you turn this off.